everyone, I'm your tutor and host, Annalise Garrison. This video is for the people that I am tutoring, but this is also going to be audio friendly because my channel is growing. People want my material on audio, they want my material on video, they want to be tutored, and I'm trying to accommodate everyone. Okay, so this video is going to be audio friendly for the people that are driving to work or listening to this audio at work on their break. So let's get right into today's topic. And today's going to be about the cardiac questions on the NCLEX. You can see, ladies and gentlemen, that I am switching, I'm changing a little bit. I'm leaning more towards getting you to critically think, right? To critically use your critical reasoning skills. So I know that I've been teaching you about stable versus unstable, but one thing I want to drive home this morning is not every heart problem is a unstable situation, okay? And I want to explain that by going over some questions. So let me just start by going over some questions here. I'm going to read questions. What I want you to write down is not every cardiac situation is a unstable situation. We're going to talk stable versus unstable. Stable versus unstable uses your critical reasoning skills, right? So let's look at this question. The nurse has received a change of shift report for the following clients. The nurse should first see the client with. Now, I'm not going to go over all the questions. I'm just going to go over the correct answer. And in this question, the answer, angina endocarditis, who is receiving Tridol infusion and is reporting a headache. That was the answer. All right? Now, why was that the answer? Because just because you have a chest pain doesn't mean you will have a headache, right? Now, remember the concept in the stable versus unstable. I said that if you see expected findings of a diagnosis, you're stable, right? Well, in this answer, angina endocarditis who is receiving Tridol infusion and is reporting a headache. A headache is not an expected finding of chest pain. A headache is an expected finding of the Tridol, right? A headache is an expected finding of the nitroglycerin the person is receiving. That's what I want you to remember for the NCLEX. I want you to remember for the NCLEX when it comes to cardiac problems that most, not all, but most of your blood pressure meds, your cardiac meds cause a headache until the person gets used to it. All right? So in this answer, angina endocarditis who is receiving Tridol and is reporting a headache. A headache is not part of the chest pain. It is not an expected finding of the chest pain. It is an expected finding of the Tridol. Okay? So, remember that for the NCLEX, because that was reported to be on the NCLEX. However the question is asked, I don't know. But that was reported to be on the NCLEX, okay? I'm going to go over some more questions that I put together that were reported to be on the NCLEX, okay? I'm not going to go over why they're right, why they're wrong. I'm just going over the question and the correct answer and why the correct answer was correct, okay? Let's look at this one as far as stable versus unstable. The nurse is assigned as a preceptor to a newly hired nurse. Which of the following, if performed first by the newly hired nurse, would indicate his or her ability to prioritize? And the answer was performing a neurological check on a client with primary hypertension who is reporting right-sided weakness. Now, how does this, in our critical thinking skills, how does this fit in with stable versus unstable? Okay, hypertension itself is a chronic disease, right? This is why the person takes medication, because they suffer from high blood pressure, right? But the reason this is unstable is because it is reporting right-sided weakness. Is right-sided weakness a expected finding of hypertension? No, not unless they have a problem, right? If they're having a right-sided weakness, that could be a sign of what? A stroke or a heart attack. A stroke or a heart attack needs to be looked at. It's unstable, right? This says a person with primary hypertension. That's something they have to live with. But the right-sided weakness is something new. Remember what I said with stable versus unstable. New changes from the assessment needs to be reported, right? If they have an unchanged assessment, that could be delegated, or that's considered stable, right? Primary hypertension might be stable because they're taking meds, but the right-sided weakness needs to be looked at. Okay? Let me use another example. Let's go down to this question. The nurse has been assigned to the following client situations. The nurse should first assess the client who? And the answer was a CVA 48 hours ago. Now, a lot of people get this wrong. Now, let me explain why, though, okay? A CVA 48 hours ago and is receiving oxygen at 24% via venter mask and has a PaCO2 of 55. The reason people get this wrong is because I said if a person was had an operation or had something wrong less than 12 hours ago, if they were post-op greater than 12 hours, they're stable. And I also said if they were admitted greater than 24 hours, they were stable. Now this CVA happened 48 hours ago. So people think, oh, they're stable because it's been greater than 24 hours. Okay? Now, in that part of your thinking, you're correct. But you have to finish reading the question. Okay? If they had a CVA 48 hours ago, everything should be stable and should be within normal limits or an expected finding or something like that, right? But the answer goes on to say, and is receiving oxygen. Okay. Well, they could still be stable, right? But it goes on to say, at 24 via venter mask, all right, and has a PaCO2 of 55. The PaCO2 is not an expected finding. It's too high. 48 hours later, the person should be stable. Their arterial blood gases should be stable, not high. You see? So that's why this was the answer. Let me use a couple more examples. Let's use this question. The nurse is observing a staff member caring for clients. It would require immediate attention if a staff member is observed. All right, I wanted to use this example because I know that the NCLEX is going to have digoxin on the NCLEX. the biggest thing you want to do with digoxin is check the potassium levels. Right? If it's too high, you want to call the doctor. Or if it's too low, you want to call the doctor. Okay? Now, one of the answers was administering digoxin to a client whose recent serum potassium level is 4.9 milligrams per deciliter. Okay, that was not the answer for this question because the potassium level is within normal limits. If the potassium level is within normal limits, go ahead and administer the digoxin. What is normal potassium? If memory serves me correct, I think it's 35 to 3.5 to 5.0. Or we could say, 3.5 to 5.5, right? Remember I said for the NCLEX, the lab levels have to be way off in order for you to pick the lab levels because every lab level varies just a little bit. So even if in your head, if you thought a normal potassium was 3.0 to 5.5, that's still close enough to 5.0, right? So a potassium level of 4.9 is fine. So you don't have to worry. It would require immediate attention if a staff member is observed administering digoxin. No, that's okay because the potassium level is within normal limits. Okay? So the purpose of this audio or the purpose of this video or the purpose of this tutoring session is just to reiterate, the importance of stable versus unstable. I'm trying to, drive that point home in the tutoring sessions. Let me see if I have any other examples that I wanted to make. This was going to be a quick video. There is one more example, okay? Again, remember that not every cardiac question is a problem, all right? But this is a problem. The nurse is caring for a client who had a liver biopsy 30 minutes ago. Which of the following would be essential to follow up? Now, the answer was change in heart rate from 94 to 80. Okay? The reason that was the answer is think about it. Okay? You had a liver biopsy 30 minutes ago. First of all, post-op, it's less than 12 hours. So that right there, this question is unstable. This question is signaling that the person may be unstable. So, a change in heart rate of 94 to 80, that is a 14 point drop in just 30 minutes. If we wait another 30 minutes and they drop another 14 points, they're going to be down to what? 64, right? Something like that. 64, 66, something like that. 80 minus 14, right? So that's why that's the answer. The heart rate is dropping too quick for just 30 minutes. Now, I could go on and on and on like this. Okay, I could go on and on like this. But I'm going to stop here for the person I'm tutoring that wants this on audio. For the rest of you, you can order this via a tutoring session or the complete hour-long audio for a small price. Just visit my website. Okay? All right, so there you go, guys. Have a great day. God bless, and I'll see you in the next video. I'll see you in the next audio. I'll see you in the next tutoring session.